Everyone, and welcome back to another DMF Kids Mental Health webinar in our Child Sexual Abuse Prevention series. Last month, we were joined by Leslie Brunette, and we learned about her experience with childhood trauma. And today, we're going to hear from her sister, Heather Pautz. Heather has an extensive education in social work with degrees from both Minnesota State University Moorhead and the University of North Dakota. She currently works at the Kids Therapy Center in Valley City, North Dakota, as a mental health therapist for children and adults. And as a survivor of childhood trauma herself, she has firsthand knowledge of the impacts of trauma and the importance of working through it in creative ways. Welcome, Heather.
Well, thank you.
Thanks for being here. We wanted to kick it off here with just a little insight into your professional experience. So we'd like to know, what are some of the things that you often see in your line of work? Are there trends that come up often? What's kind of an overview of what you see?
Sure. I think in the short time that I've been doing play therapy, one of the things that I've really learned a lot about recently and seeing a lot of is the need to focus on trauma, and that there are kids of all ages, little babies all the way to teenager, 18-year-old, that have experienced some trauma in their life. And the most exciting way to help them work through it is with play therapy, and knowing that play is often the language of children, right? So they can't express themselves in words, but they can express themselves through action and creativity. And so that trauma impacts us in so many ways. And a lot of times, what might be diagnosed as ADHD or ADD or some other disease might actually be related to trauma, right? And so my job at the Kids Therapy Center is really to help release children from those experiences in the most creative and helpful way.
And what does play therapy look like?
So play therapy is just that. Like, we play games, we try to engage children in role play, in puppetry, something called sand tray, where they can develop a story in the sand, and explain kind of their thoughts and feelings. And as a therapist, my job is to reflect back to them what I see, what are the themes of their play, and to give them permission to communicate, right, in their own way. And so it sounds maybe kind of woo-woo, like how can a kid play and get better? But it really is amazing to see from one week to the next the changes that happen when children know that they're being seen and heard and understood.
You know, we talk a lot here in our child sexual abuse prevention program about learning the signs to look for, because trauma can be occurring and we don't realize it. And you bring up an interesting point that sometimes it can look different than we expect. It can kind of be disguised as ADHD or other things like that. Are there things to look for in those instances?
There's probably a magic checklist somewhere. I can't think of that in my head right now, but I think, the biggest thing is if there's a change in behavior, if children are having trouble sleeping and eating and kind of day-to-day function, those are some of the things that we look at, is how can we help them to feel more rested, less anxious. Oh gosh, my phone battery is low. And being able to then make an appointment with someone who can kind of do an assessment of what those things might be. So if there's something they're struggling with in school or in daycare, even just peer relationships, things like that, can sometimes be a sign.
It's really, helpful, I think, that, to just give us even the marks that when the puzzle pieces seem like they're not fitting in a child's life, because, I think you've already surprised us a little bit. And for all of our listeners, what we're really looking for is how can we, as a community of adults and young adults, do a better job making sure that our kids are safe and that we prevent, and certainly that we spot and do something about abuse, and specifically child sexual abuse. So, you've already kind of presented a surprise, which is that sometimes this is children that are at an age that are non-communicative. And so you're using different aspects like play and other things because they're not at the level to be able to, have a mature conversation about it. Could you tell us a few more things that you think would be surprising to the general public that's not a counseling expert like yourself about the situations where you're seeing abuse?
Let's see. Sorry, I'm having a hard time hearing you. Shoot. Something
It's
I'm sorry. Could you repeat the last part of the question? Something that's surprising about what?
Sure can. About abuse, like who's being abused and just the things you see as an expert that you think would be surprising to us.
Oh, sure. I think specifically related to child sexual abuse, the one thing to keep in mind is that usually the child is going to be harmed by someone that's known to them. It's not the stranger next door. It's not the man in the bushes, so to speak, like maybe we were taught when we were kids, that it's generally someone that's known to them or trusted by them. And so it's important to kind of look in our own backyards, right? And pay attention to what people are spending time with our kids, and how are they interacting with them, and is there anything that is concerning to you as a parent or the aunt or the grandparent or maybe teacher about something that you see, and then to report that. Like, I think that's one of the other things that's really sometimes challenging for us is to be the person that makes that call, right? And says, hey, there's something going on in this relationship that I'm concerned about, and a child may be needing some help. The fear of maybe someone's going to be mad at me if I report, or I don't have all the information, so I don't want to report. And it's important, I think, for people to know that you are simply asking for someone to check into that you saw something, heard something, know something that could be possible sexual abuse or other kinds of abuse to children that you need to have evaluated.
Well, and Heather, because of your professional experience in this, can you walk us through what that looks like? So I mean, who should we call? What does that call look like? How can we be prepared to make that call and do a good job with it?
Sure. I've been out of the child welfare system now for a few years, but I know that, some things have been streamlined. And so now there is I believe, a statewide child protection reporting system. And so that you can still access through each of your county or human service zone agencies. But the information is probably going to get directed to the state, and they'll make a decision about whether or not, or where that information needs to get sent back to be assessed. But you're going to call your human service zone or the state office, North Dakota Department of Human Services, and report the information that you have to give as much detail as possible about when, where, who is involved, how often. And like I said, even if you don't have all the details, whatever details you can give are important, because I know, having worked at social services, sometimes we might get the last piece of information, that last piece of the puzzle, from someone who just calls to report something that they thought was maybe not super important, but to us it was like the last thing that we needed. So don't underestimate the power of the information that you have.
And it can be kind of a hard pill to swallow. Like you said, it most often happens with people that we know. It's not stranger danger, it's someone that you know. And what would you say to someone? What's some advice that you would give for someone who knows that this is happening, or is at least suspicious that it's happening, but they're having a hard time, you know, crossing that line where they might have to do that to someone they care about, or, report about someone they care about?
I guess in my own situation, it's important for me to share to people that, because the people that I loved were the ones that reported, I have a lot of respect for them, right? Like I know that it was difficult for my friend's parent to call and report this, but it was more important for her to report so that the abuse could stop, right? So I guess what I'm trying to say is, don't worry that the family member or the child or whoever is going to be mad at you. More than likely, it's going to be a relief at some point along the way. Maybe not initially, because it's scary to go through that whole process in the beginning. But now, as an adult, I can look back and reflect on how important that phone call was, and if that hadn't been made, where my life would be different. So take the risk, make the call.
Well, and Heather, this is a difficult and sensitive subject for all of us. I think for our viewers and everybody tuning in. Could you share with us too, just from your personal and professional opinion, if you have some suspicions, because you've talked a little bit about this, and I think Anna Frizzell has kind of echoed this, as well as just those intuition. You just kind of feel like something's off. About the concept of reporting rather than approaching the person and trying to confront them. Kind of maybe if somebody's at the intersection of they think something's going on and they may have a feeling like I need to go address this with the potential perpetrator or report this. Could you maybe just walk through some of the things that you've experienced, and from your personal opinion, what could be some guidance for someone in addressing this?
Sure. I think it's important to report it to someone that can do something about it, right? And not necessarily confront the person that you maybe think is causing the abuse, because there needs to be professionals involved in that discussion, so that the child can be protected, so that the family can be assessed to figure out who resources are within the family that can care for the children. Like I said, if it's incest, it's happening in the family, one of the immediate caregivers, mom, dad, siblings, whatever, then that's a kind of a different situation maybe than if the abuse is occurring from someone outside the home. So I think it's just important that if you have a suspicion, you report it to people that can do an intervention. Whether that be the county social services, maybe if it's a child that has this feeling and needs help, it's talking to a school counselor or someone else that's a mandated reporter that knows what the next steps are. Yeah. So just making sure that you're taking the right steps and not trying to manage it yourself. A lot of times there's so much more going on underneath the surface that the family needs help with. And if you just try to do it on your own, they might not get the assistance or support that they need.
So you work a lot with children and adults. Do you notice any trends specifically with adults that have dealt with childhood trauma? Because, not a lot of us realize that it can extend into adulthood, the after effects of it. Are there trends that you see there?
Sure. I think a lot of times in adults, trauma maybe starts to present itself in terms of anxiety or depression, sleeplessness, maybe self-harm, things like that, suicide. And a lot of times that has to do with the fact that their body has just kept track of all of this, right? And maybe they haven't had the opportunity to resolve what the trauma was and how it's impacting. They may not even understand that. There's a study that was that I first learned about in 2004 called the Adverse Childhood Experiences Study. And it correlates the trauma that one experiences with adult health problems, right? So a lot of adults maybe don't recognize that diabetes or depression or high blood pressure or stomach issues could be related to childhood trauma. And that trauma doesn't necessarily have to be sexual abuse. It could be a parent that was incarcerated. It could be some other drugs or alcohol use. And the study originally was developed because they were studying people who were trying to lose weight and weren't able to keep it off, right? And what they realized is there was all these traumatic things that happened in people's lives that impacted their ability to follow through, that they were using things like drug and alcohol to try to heal, or to mask, I should say, not heal, but mask what was going on in their lives. So knowing as an adult that if you're having heart issues, that you're having diabetes, you're having depression, anxiety, things like that, that it might be worthwhile talking to your medical health professional or a mental health professional about, hey, is there someone out there that can help me figure out what else is going on, right? Because it's maybe not the physical symptoms you're having, are maybe because of trauma that you've experienced. And so working through that trauma with someone who's trained in trauma therapy, or at least has an understanding of how the body keeps score of all the things that have happened to us, can really be beneficial.
And so with kids, you do play therapy. Are there sort of creative ways that you apply that to adults that are going through therapy as well?
Yeah, well, I guess the things that I try to do, there's energy medicine, so Reiki or healing touch sometimes can be helpful. Things like art therapy. So maybe you're not someone that wants to do traditional talk therapy, but you're creative, and even if you're not creative, art therapy can be really helpful. So because it's just another way for you to express yourself and to be able to get what's inside out, right? And be able to name it and work through it. And so those are some ideas, like art therapy, sometimes movement therapy. So there's might be things called dance or yoga, or all kinds of different opportunities that we use to try to help people heal.
It's really helpful to be able to sort of see this whole continuum that you've laid out for us. Starting with that, if something feels off, it most likely is. And your advice to just report, because it's not an indictment. You're not saying somebody's for sure doing it. You're just asking professionals to check into it. And I think
Right.
that's permission everybody needs to help prevent child sexual abuse, or to intervene if it's happening. Is if something's off, that you're not doing anything wrong by just asking somebody to look into it. They're trained professionals, so if something's not there, they will find that something's not there. But child sexual abuse is quite prevalent, so chances are it's happening, and you could be the one person that changes the trajectory of that young person's life by making that call. Well, and you've shared a little bit about your personal journey, and if you would be so brave to just walk us through some of the things you've learned from your personal journey and what you endured that we can be inspired from, and just more knowledge about so that we can take action to help prevent stories like this, or to help them when they do happen.
Sure. I think what's important about my story is that there's hope, right? And just because you've experienced childhood trauma, specifically sexual abuse in my case, doesn't mean that I was ruined, right? That I didn't have the possibility of having a future. I am a mother. I am a wife. I have become, I think, a pretty strong professional woman, and it could have been totally different. So what made a difference for me was having my faith, my family, my mom's family, to be able to be there to support us and to direct us to, using our own resources, which included, in my case, the Lutheran faith, to be able to help us heal, but also to participate in services, right? So we had family counseling, which in our case didn't include my dad, who was the perpetrator, but was my mom and my sisters and I, to kind of figure out exactly how do we go forward as a family, right? And how do we heal from the things that we experienced. We specifically got services from the Rape and Abuse Crisis Center in Fargo. We were I think, helped by them immensely. It was both individual and group counseling at different times. And so everybody's journey is a little bit different. everybody's needs are a little bit different. Some people may benefit from individual counseling, so some may benefit from group counseling. I participated in a group called Voices way back when, and it was basically an empowerment self-help group. We learned to share our stories in our own time and to lift each other up and to learn from one another by sharing what had happened to us and supporting one another. And I was fortunate enough to have participated in that when I was 16 years old. A lot of the women that were in that group at the time were in their 30s, 40s, and 50s. And now, I mean, at that time, I felt so fortunate, right? Because I was able to deal with this one at a young age rather than waiting till I was 50, which I am now, to start dealing with things. So I guess that's what I would want to share with people too, is to start your journey no matter what age you're at, but it's worth the work to get to the other side. And places like the Rape and Abuse Crisis Center, the Children's Advocacy Center, the Kids Therapy Center, Chrysalis Behavioral Services are just some of the ones that I know locally that were really helpful and can be helpful to people.
Well, I think, you've walked us through, what to look for, how to respond when we feel like there's something off, that there is hope to intervene both, at a young age and then also older, that there's always hope to recover and to move forward. One of the things that I feel like in this topic isn't talked about much is on the perpetrator side. If somebody's, exhibiting signs early, is there hope on that side that we could find therapy or rectify to prevent these types of behaviors from happening on the perpetrator side?
Right. And I guess I do believe that perpetrators can be helped. It's going to be a lifelong journey, like something that they will continue to have to make a commitment to be healthy. It's not just something that gets fixed and goes away, right? So they need to continue to work towards wellness. I think like any of us, but I would recommend that they receive sex offender treatment, whether that's through a local agency. I can't name any specific programs, I guess, at this point. I don't know that. But just that they get help with. And for myself, one of the things when I was a kid that the reason I kept the secret for such a long time is back then there was a show called Something About Amelia. And in that show, the child got removed from the home, and the dad who was offending the child just went through counseling at church. And to me, that wasn't fair. Like, I was like, no way, this isn't my problem, but I'm the one that's going to be punished. Right. So my takeaway from that was, I can't tell until I can take care of myself. I would encourage people not to wait that long, right? You have to trust in the system. And so for some people, maybe the church counseling is going to be enough, but I really felt, and I still do, that there's actually more that needs to happen to that, making sure that the program that you're participating in is designed to help treat sex offenders. And that removing the children from the home isn't always the answer. Yes, there's a period of time maybe where that needs to happen so that you can determine that the children are safe, and that those people and other people in the family are going to be committed to working on the issues and ensuring the child's safety. But it would have been nice, and I know the system has changed and evolved since then, to know that there are different ways of managing things. But so I guess, sorry, to go back to the offenders, yes, I think that they need to have specific treatment. If they need to engage in it and to make sure that it's a lifelong commitment for them.
Then Heather, when it comes to back to children that we might be seeing some of these signs, what are some other reasons why they might not tell you the truth about what's happening? And maybe what are some of the things we can look for in those scenarios?
Sure. I think children are going to be protective of even of the people that are harming them, right? And so I think it's important that they're given time to tell their stories. and also to be given the grace to say, yes, this happened. No, it didn't. Right. It's not that it didn't happen. It's maybe that they're not ready to face it yet, or to be able to feel strong enough to tell the whole story. And so it's probably going to be a process. Children might be interviewed numerous times before they finally tell the whole story. In my case, I was 16 at the time that finally it got reported. And at that point in my life, I was like, okay, I'm ready for this to be over. I just need to spill the beans and, bite the bullet, whatever you want to say, so that I could get the help that I needed. But a lot of times, the signs were there earlier on, and people may have even asked, hey, I feel like you have a secret. Tell me your secret. But I wasn't ready. So I think you just have to keep encouraging. You have to build the relationships and know and trust that the children will tell their story when they are ready, when they feel safe, and to know that something's going to happen, right? They're not just going to tell if they don't think anything's going to happen to help them. So that's the other important piece, is that you can't expect a child to tell, or the non-offending parent to say, yeah, this is going on, if they don't know what the next steps are going to be. So for me, that was really important too, is to be able to say, okay, Heather, this is what's going to happen. You're going to be removed from the home. You're going to go to foster care for a short time. You're going to have this person who's going to be your guardian that's going to speak for you in court. I mean, those things were not explained to me at my age, but I know, or back when this happened, because now it's been 34 years ago that this all was reported. So things have changed, and I hope that the systems and the people that are providing the services are now communicating those things as best they can to children and families, so that they know what to expect, but also that the expectation is that there will be change too.
Well, and you have such an interesting perspective, Heather, having gone through it yourself, and now you're on the other side of it every day, helping other people, recover from similar things. And are there major things that you would like to see changed with that process, or possibly even are there things that we can do?
I think the biggest thing is, don't give up. Keep asking the questions. Keep providing the services. If there's a way to streamline things, so that the story's told once, not told 5 times to 5 different professionals. Those are the things that are important. And I think that's originally why, like, the Dakota, or the Children's Advocacy Center, Red River Advocacy Center, were developed, is so that all the people that needed to be in the room to hear the story were there at the same time. And so I would just encourage that, people support those kinds of agencies, because that's important for the child to tell the story once, and for all the people that are necessary to bring forward prosecution and treatment and all of that are at the table. I guess I feel like I've been out of the child welfare system long enough now that I don't know exactly how it all works anymore, but I trust that there is a system in place, and that, people need to use those resources to be able to report child abuse and neglect if they have any suspicion. Don't be afraid to make that call.
Well, Heather, you've shared both from your personal experience and your professional experience of some things that we can really take away from. One is that this is happening and it's prevalent, and if something feels off, to report it. It's probably best not to go and approach the individual you think might be causing abuse, but to get professionals involved. And you're not making an indictment, you're just asking somebody to look into it so a trained professional can sort out if there is or isn't. I think that's a wonderful invitation to us. And the fact that there's hope. So if somebody has experienced abuse, just like yourself, is that there is a bright future ahead, that we've got tools and resources to help somebody that's been abused, and that there's hope that us as a community of adults can intervene, that we can work together to prevent child sexual abuse from happening, that we can look for signs, that we can intervene, that we can push these things from the surface, bring light to them, and address them. Is there anything else, Heather, that you'd like to share with our viewers and listeners today about this topic?
Gosh, I don't know. I think just thanks. Thank you for the work that you do. It's important and it makes a difference. And it makes a difference for children and adults alike. I just look at all of the different people in my life, whether it's my mom or my sisters or my children, or now, yay, soon a grandchild, that I wouldn't be who I am without all the people along the way, right? And I wouldn't be able to be the mother or the wife or the grandmother that I am without having had the support of all those people. So don't give up. Keep doing the work, and know that you're doing an awesome job, and that it's important that you share that there is hope. There's a light at the end of the tunnel for those that are in the beginning stages of the process. That, yeah, it's going to be tough, but you can do tough things, you can do hard things, and we can get to the joy. So
Well, thank
you.
you so much for joining us, Heather. We appreciate you sharing your story so bravely. I'm sure it's not an easy thing to do, but we really appreciate it. It's going to help save a lot of lives. Remember, if you want to learn how to prevent child sexual abuse, go to learnthesigns.org, where you can watch a 40-minute video where you can equip yourself with the tools to know the signs to prevent child sexual abuse. Thanks for joining us.
Thank you.
Mhm.